Introducing an innovative new spinal fusion approach. Minimally invasive lumbar fusion surgery takes advantage of the latest in medical imaging and hardware. Hardware like long-sleeve percutaneous screws from Aegis Spine. Minimally invasive surgeries made possible by Aegis reduction screws require smaller incisions, so they cause less tissue damage. This allows faster healing and with fewer complications. To begin the minimally invasive lumbar fusion surgery, a Jamshidi needle is inserted into the pedicles of the vertebrae to be adjoined, and a guide wire is threaded into the needles. A series of cannulas is then used to dilate the openings. Once the appropriate diameter is achieved, a tapping tool is threaded along the guide wire and pierced into the pedicles. The tapping tool is used to drill the initial openings into the pedicles. Once the tapping procedure is complete, a cannulated polyaxial screw is threaded along the guide wire into position using a driver. Cannulated polyaxial screws are comprised of a screw shank and the sleeves, which will house the bridging rod. The cannulated center allows them to be threaded into position along a guide wire. The extra-long hollow barrel of the polyaxial screw is 127 millimeters long. This lets the screw provide its own cannulation, allowing the previous cannula to be removed. Once in position, a driver is used to drive the reduction screw through the pedicle. This same process is repeated for each neighboring vertebra to be adjoined. Once all reduction screws are in place, ipsilateral screws are adjoined to one another by way of a metal rod. To perform this, a rod inserter is guided down the sleeve of one of the polyaxial screws. The rod is then maneuvered subfascially to bridge both of the polyaxial screws. A small set screw is then threaded along the guide wire into the sleeve of the polyaxial screw. A second handle is used to tighten the set screw. This torque-limited handle will click when the appropriate amount of pressure has been reached. Once the rod is securely in position, the sleeves of the polyaxial screw can be removed. This is achieved by clipping the uppermost ring of the sleeves. A sleeve remover is then inserted into the sleeves and angled to remove them. The sleeves of polyaxial screws are grooved at the base, allowing them to be easily removed. The posterior rod and screw insertion system minimizes soft tissue trauma using a transmuscular approach and subfascial rod insertion. This minimally invasive system reduces pain and shortens patient recovery time. Wire-guided insertion of cannulated polyaxial long-sleeve screws allows each procedure to be performed in one small opening. The instruments in this system also provide the surgeon with tactile feedback and have built-in safety mechanisms. The minimally invasive screw system from Aegis Spine.